Welcome to Growth Happens in the Dirt. I'm Katie Jolly, a Dr. Amen elite brain health trainer and naturopath, and this is my story of brain injury and a pathway to heal, which will hopefully help you and your loved ones. I wrote the book for survivors and their families, and then realised I couldn't actually read or tolerate screens for several months after my concussion. So if this is where you are, this is for you. Each week, I will read a few pages of the book, now available on Amazon, which, along with my story, contains clinically proven tools and methods to heal. Growth happens in the dirt, healing the brain, mind, and spirit after mild traumatic brain injury by Katie Jolly. Dedication. This book is dedicated to everyone in my life who journeyed out of the mud with me, and for you, the person reading this. I know how hard it can be, and I want you to know that you are not broken. The brain can heal. Thank you to my husband, the eye of the storm, my two beautiful children, my dad who saved my life with a random visit, and my mother who taught me that to receive, we need to give. To the concussion team who taught me many of the skills that I share in this book. For Dr. Daniel Amen and Tanner Amen and the Amen Clinic, whose revolutionary work in brain health gave me hope. Thank you to the specialists Mark Grant, Colin Hancock, Vicky Gould, Bradley Pillay, Ryan O'Connor and Brenton Clark for generously sharing their knowledge to support those with concussion. To May Gomez, Philip Romano, Juliette George, Wendy O'Callaghan and Alison Sutton, Barbara Gustafson, Sonia Nair, Vicky February and Jeff Walker, and my clients with concussion who helped me to craft this book. To my friends and Brain Gardeners community, I am grateful beyond words. Sir Isaac Newton, the famous English scientist, once said, "If I have seen further, it is by standing on the shoulders of giants." This book is built with a tribe. My healing journey has been the result of many helping hands, from mess to message, supporting you with your brain health. Keep shining. A message for you, the concussion survivor. The wound is where the light enters you. Rumi. You're in a fight for your life, for your brain, your sanity, and your relationships. Being diagnosed with a brain injury is scary, not just for yourself, but for everyone around you. It includes the ones who see who you were, as well as the rest of the world who don't understand why you've changed. Or perhaps you say the wrong thing, or some days don't want to participate at all. But trust me, my friend, you are going to grow in the dirt. It won't be easy, but it will be worth it. Small trivial tasks that were once trivial may seem hard. Your moods may feel like a roller coaster, and the biggest fear can be, will I ever be normal again? Give yourself grace and quiet. Be kind to yourself on this journey and know your triggers. The tools in this book are work that you implement daily. Some of them are forever. But when you focus on healing your brain, you'll find that a remarkable thing happens. You can start to function again. Wherever you are starting from right now, know that daily action is the secret sauce to succeed. During this journey, my marriage was in tatters. I couldn't parent, and I lost many of my friends. I also lost my job and my identity and felt worthless to the point of darkness. Everything I knew that was me was being ripped out in moments. Some days I slept in the cupboard. Some days I cried in the cupboard. Anger often overtook me, and some days I sat with nothing in my head at all. I walked into rooms not knowing why I was there, becoming so frustrated with the changes in my brain that I wanted to rip my head off. Other days I would see people and couldn't converse, feeling naked, vulnerable, and completely inadequate in the real world. I've realized that a brain injury is an inside problem. Those are the worst for others to understand. Like so many other illnesses that are on the inside, you don't get the same empathy because often there isn't visible evidence like a broken bone. But just like a broken bone, the brain can get better. You will be different, but you can be more than you feel you are right now. Growth happens in the dirt. You will be able to regain a quality of life once more, regulate your emotions, and handle humans again. I see you, and you are kintsugi, a beautiful piece of art that can be glued together with gold. From what I have since learned about the brain, there is a part called the limbic system. Feeling safe is the major key in transformation. That is why you would rather stay in bed or stay home when you feel unwell. It is why we gravitate to comfort, safety, foods, or habits when we feel unwell. To grow in this journey, you need to feel safe. So take small steps that feel safe for you. You may feel planted, but that is where seeds go to grow, in the dirt and in the darkness. Underneath the soil, you are going to heal. This is your time and you deserve your place in the sun. Every day, in every way, you are getting better and better. It is time to give your brain the ultimate reverence it deserves. How to use this book. This book is designed to be a toolbox for you and your loved ones to support your concussion recovery. I couldn't read for 7 months after my injury, so this work needs to be done together. If you are alone in your journey, I cannot stress how important it is to work with your medical provider during this time. Medical disclaimer. The information provided in this book is intended for your general information. It is not a substitute for medical advice from a healthcare professional and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your doctor or other qualified healthcare professional with any questions you may have regarding a medical condition. Do not disregard medical advice or postpone consultation with your healthcare professional because of information that you have received. My message is that mental health is brain health, and the brain can heal. Due to my own struggles with anxiety, depression, and ADHD for many years prior to the concussion. Yet when I focused my attention on healing the brain, I managed to successfully use these strategies to come off prescribed medications, including migraine, antidepressants, nerve inhibitors, and countless others. In this, I have been blessed by the collaboration of 6 specialists who have contributed to the resource section of the book. These sections are beneficial for practitioners who want to understand the dynamics and recovery of concussion more deeply. The contributors are Mark Grant, an Australian psychologist, researcher with 30 years of clinical experience, who has pioneered trauma-informed treatment of chronic pain and MUS with MDR and lately hypnosis. Vicky Gould is an occupational therapist who specialises in concussion with over 20 years of experience. Brenton Clark is a leading neuro-optometrist in New Zealand with over 30 years experience. Bradley Pillay is a neuro-optometrist in New Zealand specialising in alternative eye healing for concussion. Colin Hancock is a New Zealand and Australia registered physiotherapist with 27 years experience, and his professional background in treating concussion injury started 12 years ago managing sport injuries sideline. Ryan O'Connor is a neuro-optometrist in New Zealand who works with concussion recovery. And finally, Dr. Daniel Amen and his wife Tanya Amen through the Amen University authorized content from their book, along with some of the Amen protocols for supporting change and mental health. The chapters are built step by step as I worked through my journey, yet there is no right way to read this book, as each section stands alone with a theme. I invite you to read the book for whatever you need now. Remember that change is like an unfolding lotus flower. You don't need to implement everything all at once. Build your health like you would a home, brick by brick. With any brain injury, it is important to build your habits as you would a house, laying one brick at a time. If you're unable to read for long periods of time, choose one section, or ideally get a support person to read to you. After each story, there are teaching points for concussion, then exercises that you can start to implement for your well-being. You will see a brain icon wherever the tools begin. Be warned. When you start implementing the techniques in this book, you may feel nauseous, you may feel triggered, and you may feel tired. The idea of concussion recovery is just go to your ledge and then stop, but be consistent daily. The exercises that make you feel the sickest are likely to be the ones that you need for rehabilitation. But success is not boom, then bust. Do the rehabilitation every day until you hit the ledge, then stop. Your tolerance will grow as your brain heals. At the back of the book, specialists have generously contributed to the resource section to help you and those traveling with you on the journey. There are links to websites and recommended books to help you, even if you don't have access to services. Within this book are tools that you can begin to implement today. It is time to heal. Growth happens in the dirt.